Measles is a highly contagious infection caused by the measles virus. Initial signs and symptoms typically include fever, often greater than 40 circumflex degrees C, cough, runny nose, and inflamed eyes. 2 or 3 days after the start of symptoms, small white spots may form inside the mouth, known as Koplik spots. A red, flat rash which usually starts on the face and then spreads to the rest of the body typically begins 3 to 5 days after the start of symptoms. Symptoms usually develop 10 circumflex 12 days after exposure to an infected person and last 7 circumflex 10 days. Complications occur in about 30% and may include diarrhea, blindness, inflammation of the brain, and pneumonia among others. Rubella and roseola are different diseases. Measles is an airborne disease which spreads easily through the coughs and sneezes of those infected. It may also be spread through contact with saliva or nasal secretions. 9 out of 10 people who are not immune and share living space with an infected person will catch it. People are infectious to others from 4 days before to 4 days after the start of the rash. People usually do not get the disease more than once. Testing for the virus in suspected cases is important for public health efforts. The measles vaccine is effective at preventing the disease. Vaccination has resulted in a 75% decrease in deaths from measles between 2000 and 2013, with about 85% of children globally being currently vaccinated. No specific treatment is available. Supportive care may improve outcomes. This may include giving oral rehydration solution, healthy food, and medications to control the fever. Antibiotics may be used if a secondary bacterial infection such as pneumonia occurs. Vitamin A supplementation is also recommended in the developing world. Measles affects about 20 million people a year, primarily in the developing areas of Africa and Asia. It causes the most vaccine-preventable deaths of any disease. It resulted in about 96,000 deaths in 2013, down from 545,000 deaths in 1990. In 1980, the disease is estimated to have caused 2.6 million deaths per year. Before immunization in the United States, between 3 and 4 million cases occurred each year. Most of those who are infected and who die are less than 5 years old. The risk of death among those infected is usually 0.2%, but may be up to 10% in those who have malnutrition. It is not believed to affect other animals. The classic signs and symptoms of measles include 4-day fevers and the threxco, coryza, and conjunctivitis along with fever and rashes. Fever is common and typically lasts for about 1 week. The fever seen with measles is often as high as 40 circumflex degrees C. Koplik spots seen inside the mouth are pathognomonic for measles, but are temporary and therefore rarely seen. Recognizing these spots before a person reaches their maximum infectiousness can help physicians reduce the spread of the disease. The characteristic measles rash is classically described as a generalized red maculopapular rash that begins several days after the fever starts. It starts on the back of the ears and, after a few hours, spreads to the head and neck, before spreading to cover most of the body, often causing itching. The measles rash appears 2 to 4 days after the initial symptoms and lasts for up to 8 days. The rash is said to stain, changing color from red to dark brown, before disappearing. Overall, the disease from infection with the measles virus usually resolves after about 3 weeks. Complications with measles are relatively common, ranging from mild complications such as diarrhea to serious complications such as pneumonia, bronchitis, otitis media, acute brain inflammation, and corneal ulceration. Complications are usually more severe in adults who catch the virus. The death rate in the 1920s was around 30% for measles pneumonia. Between 1987 and 2000, the case fatality rate across the United States was 3 measles attributable deaths per 1,000 cases, or 0.3%. In underdeveloped nations with high rates of malnutrition and poor healthcare, fatality rates have been as high as 28%. In immunocompromised persons, the fatality rate is approximately 30%. Risk factors for severe measles and its complications include malnutrition, underlying immunodeficiency, pregnancy, and vitamin A deficiency.